Hi, I'm Dr. Deepikatikoo from Simply Pharmacology, and today I'm going to tell you about the must know points which you should know about the first line anti TB drugs. Very briefly, I'll tell you what all you should know. So, after I expect that you've read your books and you're prepared, but still, these are those salient features which any student should not miss, right? So, let's get right into it. So, see, the first line antitubercular drugs, you remember by the mnemonic, it's a very famous mnemonic, which is called as PERIS, P-E-R-I-S. So, remember the Eiffel Tower in Paris, so it signifies the first line anti-TB drugs. P is for pyrazinamide, E is for ethambutol, R is for rifampicin, I is for isoniazid, and S is for streptomycin. So, these are your drugs. So, what are the things you should know about them? Let's go one by one. First is your mechanism of action. So see, pyrazinamide as well as the isoniazid, they have a similar mechanism. So they both inhibit the cell wall synthesis, but they target the mycolic acid synthesis. Ethambutol also inhibits the cell wall synthesis, but the target is different, which is arabinoglycan synthesis. Rifampicin has a different mechanism. R for rifampicin, R for RNA. Inhibits the DNA-dependent RNA synthesis. And streptomycin, because it belongs to the class of aminoglycosides, we know aminoglycosides are the drugs which are going to inhibit the protein synthesis. So they work by that mechanism. So this is the differentiating features among all the anti-TB drugs. These are that you should know. Then we come to the nature of activity. So whether they are cidal or static. So whenever there is a thing which is common to all, जब सारे में common होता है, हमें वो चीज़ याद नहीं रखनी चाहिए, हमें वो चीज़ याद रखनी चाहिए जो एक्सेप्शन होती है. सो एक्सेप्शन टू द रूल इज ethambutol हियर, विच इज द ओनली वन विच इज स्टैटिक. बाकी सारी की सारी साइडल ड्रग्स है. सो रिमेंबर ओनली दैट ethambutol इज स्टैटिक. तो ऑटोमेटिकली यू वुड नो दैट रेस्ट ऑल आर साइडल. हर एक के बारे में अलग अलग करने की जरूरत नहीं है. द थर्ड थिंग, where do they act? Do they act intracellularly or do they act extracellularly? So इसमें अगेन ethambutol, rifampicin, isoniazid, तीनों के तीनों दोनों जगह एक्ट करते हैं. स्ट्रेप्टोमाइसिन इज मोस्टली एक्स्ट्रासेल्युलर एंड पायराजिनामाइड इज मोस्टली इंट्रासेल्युलर. सो प्यार ज्यादा अंदर होता है, दिल के अंदर होता है. सो रिमेंबर दैट इज इंट्रासेल्युलर. पायराजिनामाइड इज मोस्टली इंट्रासेल्युलर एंड स्ट्रेप्टोमाइसिन इज ओनली एक्स्ट्रासेल्युलर, डजंट गो इनसाइड. सो दीज आर द टू डिफरेंसेस, एक्सट्रीम्स ऑफ डिफरेंसेस. सो पी एक तरफ, एस एक तरफ, दोनों के दोनों डिफरेंट है. जो तीन बीच में एरिस हैं, दे आर बोथ इंट्रा एंड एक्स्ट्रा. और आप दूसरी तरीके से याद कर सकते हो, PERIS. P फर्स्ट आता है, P से एंटर करते हैं, S से एग्जिट करते हैं. ठीक है. सो P इज इंट्रासेल्युलर, S इज एक्स्ट्रासेल्युलर. सो बाकी बाकी तीनों आर इन ऑल द थ्री. रिमेंबर दैट वेज, राइट? Coming to the most important side effects, very, very important, because these are the group of drugs. The side effects are really, really important and you should know about them. So coming to the first side effect, which is mostly seen with these drugs, is hepatotoxicity, damage to the liver. तो pyrazinamide भी hepatotoxic है, rifampicin भी hepatotoxic है, isoniazid भी hepatotoxic है. The only two drugs which are not hepatotoxic, which can be given in liver failure, are your ethambutol and streptomycin. Please remember, ethambutol, streptomycin are the only drugs which can be given in liver failure. Then rifampicin is a drug which can be given in or safer in renal failure. So ये कुछ चीजें हमें पता होनी चाहिए. We should know about these two things. Then coming to their individual side effects, which are important, only important ones. The first is hyperuricemia with pyrazinamide and arthralgia with pyrazinamide. So these two are very important side effects to remember. Ethambutol, remember E for ethambutol, E for eye. So a lot of eye-related complications are common with ethambutol. So retrobulbar neuritis, or some कहीं पे आपको नजर आएगा optic neuritis. So it is associated with that. Red-green color discrimination. So patient cannot discriminate between red and green color. So again, these are the two things. दोनों eye से related हैं, तो eye-related toxicity is mostly seen with ethambutol. E for ethambutol, E for eye. Rifampicin हमने एक कर लिया था, it is hepatotoxic one. Then R for rifampicin, R for respiration. Respiratory syndrome, या हम कहते हैं pneumonia-like syndrome. That is very common with, or that can be seen with rifampicin. R for rifampicin, R for respiratory related syndrome. Then because there's another thing important in rifampicin, it stains the various secretions of the body. या urine हो जाएगा वो orangish colored हो जाएगा, so tears can be stained. So if someone is wearing a contact lens, तो उसके contact lens भी stain हो जाएंगे. That means an indication है कि उसके so ये उसकी eye है, because secretion stain तो ये eye है, so that can be stained, let's say थोड़ा सा orangish stain उसके contact lens में आ जाएगा. ठीक है. So rifampicin has that kind of problem because of staining thing. Then coming to isoniazid, one we did is hepatotoxicity. The second most important side effect of isoniazid, जो बहुत बार पूछते हैं, that is the peripheral neuropathy. Peripheral neuropathy because it inhibits the synthesis of pyridoxine phosphate. So you know that vitamin B6 है important, और वो उसकी synthesis जो अंदर हमारी body में, it is important for your nerves, right? So peripheral neuropathy occurs because of that. So that is why usually when we give these drugs, we always give vitamin B6 supplements. साथ में देते हैं vitamin B6 because patient can develop peripheral neuropathy. सबसे ज़्यादा important है hepatotoxicity. These are two most important side effects. The third one is psychosis. But सबसे पहले isoniazid की आती है peripheral neuropathy and hepatotoxicity. Streptomycin, like all the aminoglycosides, they are ototoxic, they are nephrotoxic. ये हमें हर एक aminoglycoside के बारे में पता होना चाहिए. So this applies. It is not an exception. इसमें भी यही चीज़ आएगी. Coming to their actions. Now actions का मतलब ये है कि किस टाइप के बैक्टीरिया पे it's acting more. So you know that in the tubercular bacilli में either they're rapidly growing bacteria or they'll be spurters, बीच में grow करते हैं. ठीक है. Then there are certain bacteria which are dormant. ठीक है. No drug is active against the dormant kind of bacteria. ठीक है. Then some are like which are present inside. ठीक है. Slow growing bacteria, rapidly growing, slow growing, spurters जो बीच में grow करते हैं, spurts आते हैं उनमें, that's why they call spurters. And the fourth one is a dormant. Dormant पे कोई drug effective नहीं है अभी तक. So, जो rapidly growing bacteria पे, the drug which is good is your isoniazid. Works well with rapidly growing bacteria. Rifampicin is very good for spurters. It goes inside the caseous material and it is very good for spurters. And pyrazinamide has a very good sterilization action. ये तीन चीज़ें हमें पता. Because question आता है, which of the drugs has the maximum sterilization activity? That is your pyrazinamide. Which of the drugs is best for spurters? That is rifampicin. Which of the drugs is best for rapidly growing bacteria? That is your isoniazid. So please remember these three important points. Coming to the root. So root again, exception याद करना है. That is your streptomycin which is given by IM route. बाकी सारे के सारे drugs are oral. So इसलिए streptomycin हम पहले prefer नहीं करते. First we prefer the first 4 drugs. अगर कोई भी drug उसमें से effective नहीं आ रही है, then we go to streptomycin because nobody would want to take intramuscular injections for this particular disease. It's a long time for which the drug is given. Safety in pregnancy. So all of them can cross the placenta, but that does not mean they are safe. So the drugs, again, the two extremes हम नहीं देते. P we have to avoid and S is totally contraindicated. ठीक है. सवाल ही नहीं पैदा होता कि we are giving them. So P and S दोनों के दोनों हमने नहीं देने हैं प्रेगनेंसी में. बाकी हम तीनों they are safe, you can give it in the pregnancy. So जो P और S का दो बार हमें importance, एक तो है कि जो P है intracellular है और S is mostly on the extracellular bacteria, and both of them are not effective or should not be given in pregnancy. ठीक है. Then kinetics में important thing is like streptomycin does not go inside your, like, does not cross the blood-brain barrier, so cannot be effective in any kind of problems over there. While isoniazid has got the maximum penetration into the cerebrospinal fluid. Then I would like to highlight upon this, which is slow and fast acetylation status, because this drug undergoes acetylation. Okay, so the drugs which undergo acetylation is one of the drugs, and which means it is getting metabolized. So either there are people who are metabolizing it slowly, or there is population which is metabolizing it fast. तो जो slowly इसको metabolize करते हैं उसको कहते हैं slow acetylators, जो उसको fast metabolize करते हैं उनको कहते हैं fast acetylators. So more of slow is there, population ज़्यादातर slow वाली है as compared to fast. और इसमें हमें important चीज़ क्या याद रखनी है, जो कि slow acetylators होते हैं, they have more tendency to develop peripheral neuropathy. may have more tendency to develop peripheral neuropathy. So these are the important points you should know about the first line drugs. And in addition, जब भी हम मल्टी ड्रग रेजिस्टेंट ट्यूबरकुलोसिस कहते हैं तो वो फर्स्ट लाइन को रेजिस्टेंट होती है. कौन सी फर्स्ट लाइन को रेजिस्टेंट होती है? दैट इज योर रिफैम्पिसिन एंड आइसोनाइजिन. If the tubercular bacilli, it is resistant to rifampicin and isoniazid, we call it multi-drug resistant bacteria, tuberculosis, and the treatment will be different. We give the other drugs. Otherwise, these are the first line drugs to be given. Okay? So I'm not going in the treatment in this particular video. I only wanted to highlight the important, the crux of all the drugs. कि क्या आपको, अगर आपको किसी पे भी question you're supposed to answer, whether it is your MCQ, whether it is your written examination, you can pick up all the important points from this particular table. So take a snapshot of this. You can pause the video in between, take a snapshot, and these are things that are must know for you, right? So if you like the video, hit the like button and do subscribe if not already done. And we'll meet again in the next week with a new topic. So till then, take care. Thank you. God bless.